Hey everyone, my name is Pranshul, and I'm one of the biological and health sciences mentors at Ready Edge Go. I know we did brief introductions a few weeks ago, but just as a recap, I am currently a third year medical student, and recently I've started doing clinical rotations, which is pretty much where I get to go to the hospital and apply all the knowledge and skills I've learned in the past couple of years in medical school, as well as undergrad, and apply it to real life scenarios. So I get to go see patients with supervisors. I get to go and perform surgeries. So pretty much I am a baby doctor in training right now. So it's been a lot of fun the past few months just getting to apply those. And the next couple of years, that's pretty much what I get to do. Enough about me. What we're going to be talking about during this video is pretty much the different paths you can take to get into medical school. I know that Miguel spoke a little bit last week regarding his path and his journey to medical school, but I'll briefly speak about my path, and we'll also discuss pretty much what the prerequisites are to get into medical school, just the very basic prerequisites, and also what you can be doing as a high school student that is currently interested in medicine, and what you can expect to have to do in college if medicine is the career you choose. So with that, let's get started. Disclaimer I want to give to everybody is that I am not on any admissions teams. So what I'm giving you is purely based on my experience and my evidence that I've learned over the past couple of years as a medical student. I've also had the privilege to sit in on interviews when we are accepting candidates to our medical school. So I have a good understanding as to what medical schools and medical schools admissions teams are looking for. So I will just be giving you my experiences and my personal knowledge, and I hope that this helps overall. So let's start with my pathway to medicine. I knew I wanted to go into medicine from a very young age. And you might hear a lot of people say that, and some people, what they understand as medicine is like, oh, I was interested in science at a very young age. And whatever your reasoning is to get into medicine, it doesn't always need to start at a young age. So if you've heard that saying quite a bit the past few years as you're talking to other people, or maybe someone's even asked you like, oh, that's cool that you want to be a doctor, why? That's just a question you should pretty much ponder with yourself, and just ask yourself as well, like, why is it that I want to go into medicine? But based on my opinion and my personal experiences, the reason I wanted to go into medicine was because I dealt with a lot of doctors from a young age. My brother actually had a condition where he had to go to the doctors a lot, and just being around doctors, going to hospitals and stuff like that exposed me to the world of medicine. Also, liking science was a big plus, so that always helps. And so that was kind of my first experience into medicine. So pretty much I'll start around high school. I wasn't a top tier student. No, by no means was I a valedictorian or anywhere up there. I kind of used high school as a way to explore what I liked, get classes out of the way that obviously everyone has to do. But I also took AP classes and stuff I liked. I took AP psychology, AP biology, those type of things where I knew I would be interested. So studying wouldn't be a chore, but it was rather a way for me to gain more knowledge into stuff I knew I would want to study in the future. So mainly in high school, I took those classes, but I also had my extracurricular activities, such as I was a pretty active member of the band, very active with Boy Scouts, and as well as I did sports for the first couple of years, playing rugby. And like I mentioned, the classes I enjoyed the most were biology, psychology, and music. So I took those interests that I had in high school and thought to myself, it'd be really fun to spend the next 4 years of my life during undergrad and college delving more into those, because once you get to medicine, you may not always have the time to explore a specific topic. So I chose undergrad as my time to do that. And going into college, so I majored in biological psychology. And some of you might be asking, well, that's cool. You got to do biology and psychology. Where does music fall into that? And so music was kind of a side hobby for me. I still enjoyed playing music. I took a few classes that involved music, such as I took a class called Psychology of Music, where I got to explore, why do humans like music? What is it in music that makes the brain so either happy, sad, how we experience different emotions when we're listening to music. So it was just a cool class overall. And even my pathway in college is a little bit different. For most, I actually thought I wanted to start at a four-year university, and I got accepted into Ohio State University. I went there and realized I did not thrive well in an environment where it was me and 1,500 other students in a class, and I can, ask questions directly with the lecturer. So going there for a semester, I realized that that wasn't the place for me. And so I came back to California and decided I would do my first 2 years of college and finish those up at a community college. So because I didn't apply to community college right out of high school, it was a little bit harder for me in order to get classes because I was at the lower end of the um, class registration list. So I had to bounce between 3 to 4 community colleges total in order to finish all my classes within a 2-year time frame that I had set myself. There's no penalty if you don't finish undergrad in 4 years. So just know that, right? 4 years is kind of the timeline that most people have set themselves, but I know people that have taken 6 years. I know people that took 10 years. So don't limit yourself in the sense that you have to finish in 4 years, and don't be ashamed if you don't do that. So I went to community colleges, and then I transferred over to UC Davis, and that's where I did my major in biological psychology, and got really good experience. And then after undergrad, I took what is something called a gap year, which is I knew I wanted to go into medical school. And so I took a year off after finishing undergrad and before entering medical school. And during that year, I took the time to apply to medical schools because that's quite a bit of a process. I also took that time to get a job and save up some money because when you're in medical school, you don't really have the time to work. So, I thought it'd be nice to have a little bit of spending money going into medical school. So I took that year. I applied to medical schools. I applied to as many as I possibly could because I wanted to make sure that I got in. And like I said, I worked, made some money. And so I finally got into medical school, got my acceptance letter to the medical school of my choice in March of 2019. So with a start date of August of 2019. So that was really exciting for me. That was a big hurdle to jump over to get into medical school because that's a huge step that you take. So let's just talk a little bit about what I had to do in undergrad, what you might have to do when you're in undergrad in order to get into medical school. And I'll also take a brief minute to kind of explain what medical school consists of and what your life may look like if medicine is the path you choose. So just going off of what we just talked about, I want to let everybody know that everybody has their own pathway to medicine. You might take the traditional route where you'll, graduate high school, do 4 years of undergrad, go straight into medical school, do 4 years of medical school, and then go straight into residency. There have been people that I know that they finished their undergrad in something completely different. They went and worked for a while, and then they went back, did their prerequisite classes for medical school, and now they're in medical school and they're 33, 34 years old. There's no right path to medicine. Some people know they want to go into medicine, from a young age, and so they'll plan their life accordingly to that. Other people might not even know that medicine is something they want to do until after they've already had another job for a while, and then they'll realize, hey, this is really what I want to do with my life. And so then they'll go back to school and get into medicine. So, there's no right path to medicine. Whatever you choose to do is the right path for yourself. Okay. So don't be discouraged if you're not following exactly somebody else that is on the path to medicine as well. All right. So let's talk a little bit about getting into medical school. So first thing you have to do is obviously finish high school, get into whatever college that is right for you, and then major in whatever major you want. And what I mean by that is that you do not need to major in a science related field if that's not something you want to spend 4 years learning. Maybe, with medical school, there's nothing that they're going to teach you specifically in undergrad, that's going to help you significantly in treating patients. Nobody's going to teach you an absurd amount of pharmacology in undergrad that is later going to go on and help you treat patients. Nobody's going to teach you surgery in undergraduate. So you don't have to be in a science related field in order to get into medical school. But with that being said, major in what you want. There are some prerequisite classes you'll have to take for medical school, but major in what you want, whether that be art, whether that be English, whether that be engineering, whether that be math. Don't limit yourself into saying like, I want to be a doctor, so I have to major in biology. That is not true, and don't let anybody else tell you otherwise. Okay. Step number 2, do well in college. If you weren't a star student in high school, don't worry about it. Medical schools are not going to look back at your high school transcripts. They don't care what you did in high school, but in college, is what they're going to be looking at. So do your best to do well in your college classes. Based on what I've seen, there's no specific cutoff for GPA. I know people that are in medical school that had a 2.9 GPA in undergrad. I know people that didn't get into medical school and they had a 3.9 out of 4 GPA in undergrad. There's not really the right GPA to have that'll guarantee you admissions, but to be on the safe side, I would say if you can keep your GPA above 3.5 in college, you have better chances of getting into a medical school of your choice. Next step is to take the prerequisite courses that are required for medical school. That being said, every single medical school is going to have a slight variation as to what prerequisite courses you'll have to take. The ones that I'm about to list for you are pretty standardized across all medical schools. Other medical schools might have slightly different prerequisites in the sense like they might not require a year of something, they might only require a semester, or they might require additional classes than what I'm listing. So take this with a grain of salt. Make sure you do your own research as to what medical school you want to go to, and make sure you complete the prerequisites for them. But in general, for medical school, you'll have to take a year of general biology, a year of physics, a year of general chemistry, a year of biochemistry, 1 year of organic chemistry, 1 year of math, and that includes a year or a semester of calculus and a semester of statistics, and then 1 year of writing. So those are all prerequisites that you're going to have to take in order to apply and be a competitive candidate. So just take that into consideration. Going into medicine, those are all classes you'll have to take. Obviously, if you're in high school right now and you're thinking, man, I really don't like biology, I don't like chemistry, I don't like physics, that might be a good time to stop and think if maybe that's something you actually want to pursue for the rest of your life. Because before you get to go and just, work with patients and be a doctor, there are a lot of classes you'll have to take. So just be mindful of that. And so then going back to the first thing I mentioned where I said major in whatever you want. Obviously, if you major in biology or another science related field like chemistry or math, the courses that I mentioned for prerequisites will most likely be incorporated into your normal workload. So that's not too big of a deviation from your major. You might not really have to take any additional classes that aren't offered in your major. If you do major in something else like music or English or arts or engineering, you might not have to take biology as part of your major. You might not have to take physics. So those are all classes that you'll have to incorporate outside of your major. So just be mindful of that if your major doesn't consist of those classes, you'll have to take those outside of your major. So that might mean that it might take a little bit longer for you to finish your undergrad, and that's totally okay. It might take you having full course load every semester in order, if you're really gung-ho and finishing in 4 years, then you might have to take a full course load every semester in order to finish in time. So I'm not discouraging you from doing whatever major you want, but just be cognizant that majoring not in the health sciences or a biological field may mean that you're going to have to take extra classes than what your major requires of you if medicine is something you wish to pursue. Next, do your extracurricular activities. Make yourself a well-rounded individual, similar to how you're doing right now in high school to prepare for college. Get yourself to become a well-rounded individual. That means doing extracurricular activities like research, hobbies, shadowing, volunteering, community service. I have seen a number of applicants come in to school and all they did was just study. It doesn't make them a good applicant. You could have a 4.0 GPA, be a valedictorian of your undergrad, but if you have done nothing other than study, that doesn't make you a well-rounded individual. Think of it like this: when you're seeing patients later on in the future, one of the big things with seeing patients is building a rapport with them, which means like you're building trust amongst each other. If the only thing you know is school and your patient doesn't like school, there's not much you're going to have to talk about. Have other interests, have other hobbies, have, community service and volunteering stuff that you can talk to your patients about later on. And also that'll help you in medicine in general. Step number 5 is do well on your MCAT. So MCAT is very similar to the SAT, ACT that you're going to take to get into college, although that's changing a little bit. But the MCAT, as far as I know, has not changed so far. So the MCAT's a very important test. Do well on it. A lot of medical schools use that as a screener. So if you don't do well on it, you'll automatically be pulled out of their applicant protocol. Lastly, the biggest thing is don't be discouraged. Everyone, like I said, has their own path to medicine. It might take you a couple application cycles before you get into medical school. Don't let your friends or your peers discourage you from medicine. If that's something that you've set yourself, if that's your goal, if that's truly what you want to do, be in it for the long haul. Be ready that, okay, I might not get into medical school right off my first application. It might take me a second one. Make yourself the best applicant that you can and keep trying as hard as you can. You might be one of the lucky few that gets in on their first time, or you might be one of the people that has tried 3 times and then they finally get in. So just keep that in mind, that it's a long process, and don't be discouraged throughout the whole thing. But I hope that this video has been helpful in kind of telling you what you can expect once you get into college and getting into undergrad, and what you'll have to do during undergrad to set yourself up to be a successful candidate for medical school. Lastly, what I want to discuss is what can you expect once you're in medical school, right? I've set myself up, but now what do I get to do? So most medical schools are structured in a way that the first 2 years are lecture-based classes. And so you'll be, very similar to undergrad. You're going to be taking lectures, you're going to be learning about different systems in the human body, different physiological processes, and a lot of pharmacology, so learning drugs and stuff like that. And then the next 2 years of medical school is when you get to go into the clinics and rotate. So that's the majority of medical schools. Every so often you'll run across a medical school that doesn't follow that pathway, and you can look around. I'm not going to dive into every single type of curriculum there is, but the most common is the one I just explained to you, where it's 2 years of in-classroom instruction. They call that preclinical years, and then 2 years of clinical rotations. After that, you have residency, which can be anywhere from 3 to 7 years, depending on what you choose. Family medicine is usually a 3-year residency, for example. That's one of the 3-year ones. And if you want to be a neurosurgeon, that can be up to 7 years. So that's still kind of schooling, right? So you're still going to be working a lot more hours than you would probably until you're a practicing physician. But just be mindful of that too. That's one of the big things with medicine. You're going to be in school your entire life. You're going to be learning a lot. Medicine is a changing field. So just be mindful of that, if you're not a huge fan of school, if you're not a huge fan of constantly evolving fields, just rethink about if this is something you want to do for the rest of your life, okay? But I hope this video has been helpful. As always, feel free to reach out with any questions. And look forward to speaking to many more of you soon. Thank you.